There's a lot of buzz around a lot of topics in our industry, fresh versus frozen, especially in donor egg IVF. And I want to hear from you and your clinical experience. Are there situations where a fresh transfer still could be better, or do you still lean toward frozen in most cases?
That's a great question. So, in the practice that I'm currently in at Army, New Jersey, we are typically a frozen embryo center. So, freeze all, do everything up front. And that's really truly because of safety, improved technology of freezing embryos and then thawing them later on when they're ready to be used. And then also that risk of ovarian hyperstimulation and allowing that patient to recover from their retrieval before we put in this embryo. And there's a lot of different reasons that we consider that, and the reason that I recommend frozen embryo transfers for the most part. But you're right, there is a small cohort where rarely we will recommend a fresh embryo transfer for a patient in our fertility world. And that's really if they're older, we're worried about that embryo surviving in our lab beyond day 3, and we think that it's probably better to just attempt it without testing it genetically and just transfer and see what happens. But of course, it comes with its risks. So I'm always
Right.
a little bit wary to counsel patients on that.
Right. And I think also when it comes to scheduling things, getting your lining ready, making sure it's thick enough and making sure you have the meds and all the education, sometimes frozen can be the best way forward.